Before going into the topic details, I want to bring your attention to the UPSC coaching programs offered by ClearIAS. ClearIAS offers online and offline courses to help candidates get selected for prestigious government services like IAS, IPS, or IFS. ClearIAS, Prelims cum Mains, PCM course, provides a highly effective study plan, well-organized subject-wise videos, study materials, mock exams, and guidance to cover the entire GS syllabus of UPSC CSE Prelims, Mains, and Interview systematically. As a limited period offer, there is a 40% discount on our online courses. Enroll now.
Alright, see, the next topic is actually all about Mpox, or what we say Monkeypox. Right. So why it is actually Monkeypox in the news, why we are taking it to the current affair classes, is because the WHO, that is the World Health Organization, actually released a very recent warning regarding monkeypox. That is, they were actually asking about everybody should be very much cautioned because there is a new type of disease coming. That is what the advisory or the warning actually came. So we are going to understand what is this thing called monkeypox and what are the symptoms, how it is actually spread, etc. And also, then when we talk about COVID-19, there was one particular variant that is called Delta. There was one variant that was called Omicron. So just like that, in the monkeypox also, there is one variant that is Clade 1B variant. So we'll be understanding what this particular variant is. And even Indian government also, the government of India also issued basic guidelines if such a monkeypox is actually detected in India. So it is actually relevant for the entire world, for India also. So that is what we are going to understand in this particular session. So that another word, that is WHO Director General declares, this is actually a screenshot from the WHO itself. Mpox, that is monkeypox outbreak, a public health emergency, that is PHE, public health emergency of international concern. This one word is actually extremely important, PHEIC, that is public health emergency of international concern. The last time the WHO actually declared PHEIC is actually while during COVID-19. But there were multiple times the WHO actually issued this very same thing. So we'll understand what this particular public health emergency is, when does they declare this particular thing, etc. So that is the point. And here we have to also understand that this particular thing, called monkeypox, was actually detected in one particular country that is called as the Democratic Republic of Congo. So it is an African nation. It is actually on the very center part of the African continent. And in this particular country was the hotbed of the particular disease, monkeypox, because almost 90% of the world of the detected diseases are actually from one country. So just like that, when we are actually, we say that the COVID-19, the virus was actually originated in, which was a country, China. There is one place, Wuhan, and it was actually originated. So just like that, it is actually in the Democratic Republic of Congo, where this particular disease actually is rising in numbers, and it is actually in the it is actually the second time in which the emergency was actually declared because of the monkeypox. And we have to also understand that this monkeypox virus was actually detected in 1958. So it was detected in 1958. But why it is called as monkeypox? Monkeys are actually falsely accused of this crime because they are actually not the thing which are actually originally hosting this thing. So it was actually identified in 1958, and later on in 1970s, this particular virus was detected in the monkeys, which was captured, and then itself that they actually gave the name monkeypox. But it was not the monkeys which are the original host of this thing. The scientists are saying that it may be some rodent. Rodent means rats and all. So all the different kinds of rodents, and maybe some other kinds of organisms maybe are the original host of this monkeypox, but it is not the monkey. So that is another small statement. Consider the following statements regarding monkeypox. The monkeys are the original, a type of monkeys found in Africa, are the original host of this particular disease. No, it is not right. Because it is only because the virus was found in them in 1970s, the name was actually given. So that is one very small, funny, but very important point we have to understand. It is not the primary host actually. So let's move into this particular topic. It is a comparatively smaller topic. There is no much analysis and all. We have to just understand some of the facts only. So what is actually Mpox? Mpox is actually one viral disease. So it is a viral infection that is caused by a virus. That is why it is viral disease. So one thing is actually it is a viral disease and it is a zoonotic disease also. The another word is zoonotic. What do you mean by zoonotic? In a zoonotic or zoonosis, the word which means that this disease can actually spread from animals to humans, just like COVID. So COVID could have been it is actually estimated that it actually was spread from a wet market in China. So just like Nipah, just like Zika, the particular disease can actually spread from animals to human beings. So that word is actually called zoonotic diseases. So that is the second thing. And they are actually mainly found in and near the tropical evergreen rainforest regions. It is this particular belt, this particular disease is actually majorly found just like Democratic Republic of Congo. It is also near to the equatorial region. And India also is actually very close to the equatorial region. So that is why they actually was very much concerned also. And till now, no monkeypox has been discovered so far. But still, we are actually under very much surveillance. And it is widely estimated that rodents like squirrels or rats or are also the primary host also. Now, when we understand what is this disease, we mentioned that this in the 1970s DRC, it was detected in the monkeys and they gave the name monkeypox. And the second thing is actually how it is actually spread. How this disease is actually spread. So just like COVID and all the things, definitely it is spread by close contact actually of this particular people or close contact with infected animals. This is the main method in which this particular disease is actually being spread, which means that this particular disease is just like, for example, Nipah. This virus does not live very long. It actually was activated when the body fluids are actually taken from a man or a person. It actually lives very short period of time. So only if you are actually in a very close contact, then only this thing is actually spread. What about COVID? COVID is actually not that like that. If I'm actually COVID infected person, if this phone will also be infected, and if this phone is actually kept here and I go somewhere else, and some person come and some person touches this phone and again goes to the nose, then actually that person can also be infected with COVID. It is actually long distance traveling. This is short distance. Only if you are actually in a very close distance, then it is actually spread actually. The third thing is, what are the symptoms associated with this particular thing called monkeypox. So as you can see this particular image, there are different symptoms and one of the major symptoms is actually rashes. So this is another screenshot taken from WHO itself. So the different kinds of rashes are seen in the people and some other types of symptoms such as fever will be there and swollen lymph nodes will be there, headaches will be there, muscle aches, low energy and other painful situations, painful acting and will be there. So all the different kinds of things will be there, but the major symptom is the rashes and the different kinds of swollen lymph nodes which are actually seen in this image. So these things are actually taken from the WHO straight away itself. Again, this list can be a question in the UPSC exam. They can straight away ask you, there are different symptoms, which of the major symptoms are actually seen in the monkeypox disease. They can straight away ask you. It is a very straight, direct question. And why they will ask you this question? Because it is in the current affairs. Right. So that is one aspect. What are the symptoms which are actually seen in this particular disease? So, and all the flu, all the fever, all the skin lesions and everything will be related with this particular thing. And the next thing is actually about the region where this particular thing is actually found. We already mentioned about the Democratic Republic of Congo. So where is this Democratic Republic of Congo? The DRC is actually located exactly on the center of the African continent, DRC. So just like that we did in Ukraine, that Ukraine war topic also. So when we think about this particular thing called, region, we have to understand the different countries surrounding the Democratic Republic of Congo because it is extremely in the news. That is the reason. So when we think about Democratic Republic of Congo, I'm just drawing it outside. So the top country is actually Central African Republic. It is just above the Democratic Republic of Congo and the Central African Republic. And then to the left of it, that is to the west of it, we have a country that is called as Congo. So Democratic Republic of Congo, then there is Congo here and we have Angola here. We have Angola here. Maybe they'll ask you some other question, but the map is actually extremely important. The map of Southeast Asia, the map of Africa, the map of Northeast India. So these three things are actually extremely complex. So the mainland India and all the things are actually you can simply understand. but the complex maps, it is actually very much important. So make sure that whenever some current affair event happens, take the map of Africa, take the map of Northeast India, just understand which are the locations which are located where. It is very, very important. And then that is actually Angola there, and the down south country that is actually called Zambia. That is called Zambia. And then near to that Zambia, there is actually small two confusions. There is actually Tanzania, and then there is Uganda. Tanzania and Uganda. All the Animal Planet and all the National Geographic things which you see in the television, all the lion hunting, all the cheetah running, all these things are actually happening in and around the Tanzania and Kenya, Uganda region. So it is actually very famous location for that. So then there is Uganda, and then straight above there is actually South Sudan. Why we mention South Sudan? Because this is Sudan. So there is Sudan, and just below there is actually South Sudan. And all these nations are surrounding the nation that is called as the Democratic Republic of Congo. And it is not just that, there is actually mild confusion regarding that thing, because two countries we left out. Which are the two countries? Those two countries are actually here. You have to understand which are those two small countries also. So when we take this particular thing called Congo, Democratic Republic of Congo, what are the two countries we left out? The two countries are Rwanda, and the other one is actually Burundi. It is actually extremely small. So other than the Central African Republic, the Congo, Angola, Zambia, Tanzania, Uganda, we already mentioned about everything like that. The South Sudan, etc. There are two more countries, Rwanda, and the thing is actually called Burundi. These two countries are also surrounding what is known as the Democratic Republic of Congo. And these countries are actually extremely affected by the monkeypox also. Right, the two small countries are Rwanda, RWANDA, and Burundi. So these two countries, and to add data to that, when we have to understand two different lakes also. We can see two different blue portions. The first blue portion is actually Lake Victoria. The first blue portion is Lake Victoria, and it is a very important lake, actually very famous lake. You have to also keep in mind that which are the three countries bordering Lake Victoria. The three countries are Uganda, Kenya, and Tanzania. So it is actually in the tri-junction. This particular lake is actually the tri-junction of Tanzania, Kenya, and Uganda. In between you have Lake Victoria, one particular point. And the next important lake, only two important lakes are there. The second important lake is actually here, in between the Democratic Republic of Congo and Tanzania. It acts as a border. This particular lake is acting as a border in between the DRC and Tanzania. Which is that lake? It is actually called the Tanganyika. It is the lake that is actually called Tanganyika. So this lake Tanganyika also is actually acting as a natural border between Democratic Republic of Congo and Tanzania in between. So that is the thing. And the first one we said was Victoria, which is actually in the tri-junction of these three countries, Tanzania, Uganda, and Kenya. So when we study lakes actually in geography, we'll be studying what is the lake, what are the origin, what is all the different features. But when a region is actually important in the current affairs, when we go to that particular map of the region, if we find lakes also, we study it separately. Right? If we find a major important river, we study it separately. That is my point here. It is actually very much extremely important in the UPSC prelims exam. That is the first ever stage of exam, and which mainly most of the people consider the most difficult part is prelims. Because once you clear the prelims, it is more or less, you'll be, one time if you clear the prelims, it'll be easy for you. And I'm not saying that mains is too much easy, but there are people who find prelims tough. There are people who find mains also tough. So make sure that you understand the map of the location whenever you are going through these particular things. And the last particular different things we have to understand is, we mentioned about the region, and who all are actually extremely affected is, there are actually two different variants we just mentioned, like Omicron and Delta of COVID-19. So there is clade 1A and clade 1B. Different types of variants are actually there. And it is actually said that the clade 1A virus, it is actually mainly affected by the different bisexual communities, gays. All the people are actually affected by clade 1A. And the clade 1B is actually mainly affected by children. And this particular spread of monkeypox virus is actually mainly affected by clade 1A in that particular region. So all the different types of homosexuals and bisexual activities, when that is actually happening, it is the major reason why this particular disease is actually spreading in that locality. And it is when the disease actually spread, it can actually pass from one person to another when they are actually having a close contact also. So that is one thing. And clade 1b is there. It is not the major reason of this spread, but it is mainly spreaded in the children actually. And the last but not the least, what we have to do, we have to understand that this particular disease is actually, there is actually preventive things are actually not that much discussed. So that is one particular thing. But they are saying that one particular vaccine that is called Jynneos, which is given for smallpox, etc., that can actually be given to those people who are infected by the, or there is a chance of people who are going to be infected by the monkeypox. This particular vaccine can be given. So this is a vaccine dedicated for smallpox, but can be given to the monkeypox patients also. And you have to also keep in mind that once this particular disease comes, it can be cured also. If you get the disease, they can go to the doctor, and the fatality rate is not that much high. That is the point. And the last thing we have to understand about this disease is about the public health, and we just mentioned about the public health emergency of international concern, PHEIC. And what is this thing? Because it is a current affair event. So what is this thing? When does this particular WHO issues this thing? When an extraordinary event, which is, it is an extraordinary event which is determined to constitute a public health risk to the other states to the international spread of disease. So whenever there is a possibility of an international spread of disease and to potentially require a coordinated international response, these are the times in which WHO issues a public health emergency of international concern. It happened during COVID. It is actually happening now also, because the world actually requires a coordinated approach to tackle what is known as the monkeypox. And the next thing is that in the WHO website itself, they actually gives 3 different situations when the PHAC is declared. What are the 3 different situations? When there is a serious, sudden, unusual or unexpected outbreak is there. Exactly like COVID. So we were not expecting COVID virus to spread like that. Suddenly, when the entire world was actually spreading, suddenly WHO declared emergency. So when it is expected, unexpected, serious, sudden and unusual. The second thing, it carries serious implications for public health beyond the affected state's national border. That is, if that particular disease has the potential to spread actually, then they actually declare a particular emergency. And the third thing is, it may require immediate international action. Why? Because if there is no action, then it may spread. When the 3 situations are there, they actually declare it as a PHEIC. That is the point. And the last thing is that in history, there are certain times in which it was actually declared. For example, in the African region in 2009, because of the swine flu, that is H1N1, it was actually declared. So it is not the first time. And the second thing, in 2014, when the polio virus was actually spread. This was actually in the Afghan and Pakistan regions. So near to the Afghan-Pakistan region, when the polio virus was spread in 2014, they actually declared an emergency, WHO. And this white flu was actually in the African countries actually. And the third thing is Ebola virus, when it was actually declared in 2014. Again, the WHO declared this thing. This was in the African region. And in 2016, when the Zika virus was actually spreading near to the America, that is North and South American region, in 2016, they declared. And the third last thing is Ebola virus. They actually want to differentiate between this Ebola and this Ebola. So they mentioned the word Kivu. So this Kivu Ebola in 2019, and last but not the least, COVID-19 in 2020, now monkeypox in 2021. You don't have to remember all the year, etc., like that. Just know that there were multiple times in which this particular emergency was actually declared before. They can ask a statement that is, it is for the first time or the second time after COVID-19, this particular thing is issued. No, it is not like that. It is not the first or second time. They have issued this warning before also. Starting from 2009 onwards, from the swine flu, H1N1 onwards, they have asked you this thing multiple times. So this is what this particular thing is actually all about. This topic is all about. And the last thing is actually in the recent times, there were news reports coming in the Indian media also that from 2022 onwards, our ICMR, that is Indian Council of Medical Research, they are also conducting what is known as sero surveys to assess the mpox risk in India. So what is a sero survey? Just taking samples from random population to know if there is a spread of mpox, if there are proper antibodies created in us, if everything is okay, if there is a risk or not. that thing is actually done by ICMR, which is in India also. So that is the current affair news that is called as the particular thing called monkeypox. Right. So we'll go to one small topic and finish the first session of this class.